March 20th, 2024, the hick doctor, Tim, from Georgia, filed a CA2 on my feet and ankles due to work-related injury. Process of getting my knees and hips added. Oh, here's the, if I obtain your services, what percentage of a scheduled ward do you retain? Scheduled ward in federal workers' comp is you do a rating and you get an impairment rating, okay? If anybody's ever taken anybody's scheduled ward, gets a piece of their scheduled ward, turn them into the medical association. That's fraud. You know, it doesn't cost you anything to do a scheduled ward. Government pays me to do it, and you just, it's your money. And people do, some people get awards on VA too. That just is unconscionable to me. Okay, so that's okay. Okay. Getting your hips and knees out, you're having trouble, we'll be glad to help you on that. Now here is from Missouri, Mike, working on Mike's Nexus letter, probably already done. Would you like to dictate the same day we see you? Also, when I'm dictating, you say, if I say right, you say left shoulder. It's nice to know. Okay. Are you still seeing patients? Not could you direct me to someone who's not part of the system? Now, the only patients we treat are federal workers' comp. We don't treat vets, but we do their VA Nexus letter, their causation reports. You're in Branson, finding a doctor other than a VA nurse practitioner. Hey, those people are good. Okay. As far as treatment. But now, at Nexus reports, be careful. 50% of litigation requires a doctor's opinion, and you're talking about a few people even teaching this stuff, much less anybody knows how to do it. We really don't know the standard for reasonable medical certainty, reasonable medical probability, more likely not in the VA system. Okay. All right. Thomas from Texas, retired back in '96, flat feet 10%, lung lobectomy 10%. Lobectomy, just 10%, that's bullshit. Anyway, you have a total of 20. Treating for diabetes and chronic kidney disease, stage 4 kidney disease, served in Germany. VA diagnosis found hypertension. Is that service connected? Or if it's not service connected, did you gain weight from your flat feet and your lung lobectomy? If you gained weight, that contributes to hypertension, that makes kidney disease service connected. And then we get the whole thing taken care of, okay? Okay, Jessica from Ohio. Help fill out information necessary, competency determination, FERS disability. A FERS disability, you just send your stuff in, depending on what you've got, you might be able to do it by telehealth. And you can't do the job for which you're hired. It's not Social Security. No sustained gainful employment. Right? So, classic is a guy's got a fused neck, he's a crane operator, he can't do that anymore, but he's not Social Security eligible. But he's certainly FERS eligible. So it's not competency, it's can you do the job which you're hired, does it bother you, and are you endanger yourself and others? And the law is very, very fair, but in the last couple of years, the Boyer's retirement system is fighting everybody. The law is very clear. In fact, I just had one today. Dr. Ellis doesn't have a doctor-patient relationship. If that's true, no one's getting FERS. So I wrote a letter to the person. I said, cite the reference, bitch. Where'd you come up with that? Look at I teach this stuff. I'm a professional. I got 42 things hanging on the wall. 18 in medicine, the rest in legal medicine. If I say you can't work, you can't work. And if you have to be a treating doctor, then no one's going to get FERS, because we had a patient who got the letter from the Office of Personnel Management, answer these 4 questions. Since it said federal government, he wouldn't even touch it. So that person could never get FERS. So someone pulled something out of their anatomy. If you want to know what part, I'll tell you. It's this part right here. Right out of their ass. Pulled up with that shit. You got, but if I saw you are now, we have a doctor-patient relationship, I don't have to give you an aspirin. So some layperson has come up with something out of their ass, and that's just wrong. If an insurance company did it, it'd be millions of dollars in bad faith writing stupid stuff like that. Okay, I wish I knew the person's last name. All I got is their first name. They don't even give you a damn last name. Judge and jury, they probably don't even have a high school education. Oh, pissed me off. Okay. So here's Missouri, Daniel. Nexus letter, toxic exposures and prostate cancer. Send us the stuff. We'll give you a call. Yeah, we can do that. But now I may not agree, but you know. Now, of course, if you're Tampa Lejeune or something like that, that's easy. If you're step Vietnam or you're in Thailand, you know, that's covered. Okay, so this is, I have a closed denied claim over 3 years ago, still hurts. Saw a physician assistant on base. You don't have to go to base to see a doctor. You get to pick yours. Okay. That lack of medical evidence, of course, the person doesn't know how to write a report. That's okay. But and a case is closed and denied, but never really in federal workers' comp. It just didn't have enough medical evidence. Let's open it up 50 years later, okay, and provide the medical evidence. And also, the PA is not authorized to provide initial medical opinions. Just this year they are, but they have to be countersigned. The nurses and PAs and nurse practitioners can sign certain forms, but you have to have it signed by an MD or DO or psychiatrist or psychologist. Okay, but anyway, she wouldn't know how to do it. He wouldn't know how to do it, and so just you know, send your stuff in. We'll look at it and give you a call and see whether you need an appointment. We may be able to do it over the phone and get you covered, man. It's just paperwork that doctors don't know how to do, and we like kicking ass and telling the truth, and that's all we ask the government to do is do the same thing, follow your rules. And if you don't, I'm coming down on you hard. God bless you all.